So one of our big questions that we've met with some people on both like the public side and on some of the private side with NGOs and like here in Uganda, understanding who would be the best or what would be the best organizations to work with to deliver the device to the people that need it. People in a rural setting, sort of a health center 1, 2, or 3. And we've heard kind of different things. One that if you go through the Ministry of Health and the public sector, you get the approvals, but they don't necessarily make the decisions on acquiring the devices for specific sites. That you might need to work with specific NGOs or nonprofits and others to actually, like they may actually make the decisions for procurement. So that's one of our big questions that we're trying to understand.
Yeah, the Ministry of Health, of course, policy-wise, they are supposed to be in charge of everything, and so they do the whole policy thing, and so they need to have that approved to come into the country. But when it comes to implementation, at the moment, when it comes to HIV care, I think the non-government organizations have probably like 80% stake in the implementation. So I would say all these PEPFAR-funded, CDC-funded projects. Like here, for example, we have JCRC, which is the Joint Clinical Research Center, is doing more of the lab side of things. So, and I think it has the mandate to do that for the next couple of years. And then there's MJAP, Mbarai Mulago Joint AIDS Program, which is doing more of the patient care, but it has some labs in some satellite centers.
Do they have kind of outreach efforts, or do they just have labs within the teaching hospitals?
No, they have outreaches. Actually, MJAP has a lab in town. It has a lab in Wizwera, which is about 20 miles out of here. So they have some satellite clinics as well.
Okay.
And so most, I think, the implementation side of things. The government in the long run, well, we want it to be there, we want it to be, because these NGOs are 5 years or something like that. In the long run, we want the government in position to take over all that. The ARV situation, the government is trying to fill in, but we're not so sure at the moment. If the NGOs left, there would be a huge gap. So the government needs to be on board, but for these next 4 or 5 years, implementation is probably going to be mainly the NGOs.